Hello everyone, this is Dr. Shravan Kumar. I'm a pediatric faculty. Pediatrics is one of the most important subjects if you are preparing for any medical competitive exam in India. If you look into the previous NEET exam, they have asked 15 questions from the pediatrics. Yes, it's a huge number. So when you are preparing for the pediatrics, you must know what are the important topics to prepare from the pediatrics. So here I'm going to discuss about the important topics in the pediatrics in two parts. In part 1, I'll discuss about neonatology and general pediatrics. In part 2, I'm going to discuss about systemic pediatrics. So guys, if you look into the video here, the first thing is the basic definitions in the neonatology. Yes, basic definitions like small for gestational age, large for gestational age, and when do you call a term baby and when do you call a preterm baby, and not only that, about low birth weight and when do you call very low birth weight and about extreme low birth weight. Yes, they are very basics, but you can expect questions from these topics like small for gestational age babies, large for gestational, term, preterm, low birth weight, very low birth weight, and extreme low birth weight. So the another topic is neonatal resuscitation. Yes, you have to be perfect with the latest NRP guidelines like neonatal resuscitation program guidelines. So from the neonatal resuscitation program, they may ask you like what is the ideal time to start the chest compression and what is the ratio of the chest compression and when you have to use the AMBU bag. And this AMBU is also very important in the image-based questions also. And not only that, about the drugs which will be used in the neonatal resuscitation. So these are the important topics from the neonatal resuscitation. So the another topic is normal variants of the newborn. The normal variants of the newborn means the newborn will be presented with kind of presentation that may be skin manifestation, that may be other manifestation, but they are absolutely normal. Most of the time, this topic you can expect in the image-based questions. See the topics like milia, erythema toxicum, Mongolian spots, Epstein pearls, and stork bite. So these are the basic examples and important thing you have to remember. You have to study about the normal variants of the newborn. The another important topic is neonatal reflexes. From the neonatal reflexes, if they ask the question, they may ask like when does this reflexes will appear and when does they disappear. So the important reflexes in the newborn are Moro's reflex. So when you're preparing for the reflexes, for example, if you take the Moro's reflex, questions may be like when does this Moro's appears and when does this Moro's disappears, and when do you see the where do you see the exaggerated Moro's, where do you see the abnormal Moro's, and where do you see the persistence of the Moro's. So these are the important questions which you can expect from the reflexes. Not only Moro's, there are other important reflexes like sucking reflex or suck swallow reflex. The another thing, asymmetric tonic neck reflex, or grasp reflex, or else the reflex which persists throughout the life, which is parachute reflex. So these are the important reflexes you have to prepare for. The another important topic is neonatal hypothermia. In the newborn babies, the heat will be produced due to the metabolization of the brown fat, but not due to the muscle activity. Yes, metabolization of the brown fat. This is very, very important. It is called as non-shivering thermogenesis. Non-shivering thermogenesis. So this is very important if you are preparing for neonatal hypothermia. When you are preparing neonatal hypothermia, and this brown fat is located at nape of the neck, interscapular area, around the kidneys and adrenals, and around the blood vessels. So these are the important questions you can expect from the neonatal hypothermia. So the next topic is kangaroo mother care. The advantages of the kangaroo mother care is very important. Advantages like that it helps to increase the birth weight of the baby, it increases the breastfeeding for the baby, and also it increases the bonding between the mother and baby. Not only that, the position of the baby is also very important. Position and advantages of the kangaroo mother care, these are the two important things you have to be thorough. The next topic is care of the low birth weight. When you're studying care of low birth weight, they can ask you questions most of the time about feeding. Feeding, like when is the ideal time to start palada feeding, when do you start spoon feeding of a low birth weight, and when do you start breastfeeding, or the low birth weight baby. These are the important topics. To understand the pathophysiology of an infant of diabetic mother, you must understand Pedersen hypothesis. Pedersen hypothesis. And when you are studying this infant of diabetic mother topic, you have to remember the most important thing is complications of IDM baby. So this is the place where you can expect questions from this topic. Another important topic here, it is neonatal hypoglycemia. The definition of a neonatal hypoglycemia, according to the World Health Organization, if the blood plasma glucose is less than 40 milligrams of deciliter. This is very important. And also clinical features of a baby with hypoglycemia, and also how we are going to treat a baby with hypoglycemia. For example, the most important thing is how we are going to treat symptomatic hypoglycemia and how we are going to treat asymptomatic hypoglycemia. The another important topic is perinatal asphyxia. It's also called as hypoxia of ischemic encephalopathy. So in this topic, the severity of the baby with a HIE has been done or has been assessed with Sarnat and Sarnat staging. Sarnat and Sarnat staging. This is a very important staging where you can expect questions from this topic. You have to be perfect with. Sarnat and Sarnat staging is used to assess the severity of a baby with perinatal asphyxia. The another thing is this hypoxia. If the term baby is affected, the most common area is parasagittal area, where these babies may present with a spastic quadriplegia, whereas if it is in the preterm baby, HIE or asphyxia in a preterm baby, periventricular area is the most common site, whereas these babies may present with spastic diplegia. Okay. The another topic here, it is a respiratory problems in the neonate. When it comes to the respiratory problem, the most common problem is the respiratory distress syndrome. Yes, in this topic, the question may ask, or you have to be perfect with surfactant. The composition of the surfactant is also very important, and also prenatal prediction of the surfactant. Prenatal prediction of the surfactant levels, like investigations like lecithin sphingomyelin ratio and Sheck test, which is used to assess the surfactant in a baby during the prenatal period only. Not only this, to assess the severity of a respiratory distress syndrome baby, the scoring which have been given is Silverman-Anderson scoring, Silverman-Anderson scoring, and the other one is Downey scoring. These are the important things to assess the severity of the respiratory distress syndrome baby. This is a place where you can expect questions. The another important topics from the respiratory system of the newborn baby are apnea and transient tachypnea of the newborn. So these are about the respiratory problems in the neonate. Moving on to the next important topic is neonatal hyperbilirubinemia. So in this topic, the important thing is you have to understand what is physiological jaundice and what is pathological jaundice. The differences between the physiological and pathological jaundice, and the definition what is physiological jaundice and what is pathological jaundice, and what are the risk factors to develop physiological and to develop pathological jaundice, and not only that, about complications. Complications like kernicterus is also very important. The another thing is how we are going to treat a baby with a neonatal hyperbilirubinemia, like phototherapy. It's very, very important, and also exchange transfusion. Exchange transfusion. These are the specific areas where you have to concentrate. So the next topic is neonatal sepsis. Depends on the presentation of the symptoms. It has been divided into two parts. One is early onset sepsis, the other one is late onset sepsis, which is very important. And risk factors to develop early onset sepsis and late onset sepsis also, it's a very important. And usually in adults, this sepsis will be presented with a high grade fever. But when it comes to the newborn babies, usually these babies will present with hypothermia. These babies will present with hypothermia. And also in this topic that you must read about sepsis screen or investigations which you have to done in a neonatal sepsis baby, and also treatment part is also very important. So in necrotizing enterocolitis, the thing you have to remember is, if any preterm baby with abdominal distension, that you have to suspect this baby might have necrotizing enterocolitis. In this topic, risk factors to develop necrotizing enterocolitis, and to assess the severity, the staging has been given. It is called as modified Bell's staging, which is a very important thing. Modified Bell's staging. It is given to assess the severity of the necrotizing enterocolitis baby. So the next thing is TORCH infections, toxoplasmosis rubella cytomegalovirus. See, whenever you read microbiology, whenever you read medicine, OBG, pedia, in each and every subject, you will read about these TORCH infections. That's why it's necessary, you must read about this topic. So coming to the next topic, which is congenital malformations. In the congenital malformations, congenital diaphragmatic hernia, neural tube defects, and hydrocephalus. These are very vital topics from this topic that you must read. So far I have discussed about the important topics from the neonatology. Now I am going to discuss about the important topics from the general pediatrics. In the general pediatrics, growth and development is very important. Growth and development. From the growth, anthropometric parameters of a child, anthropometric parameters like weight of a child, height of a child, mid-arm circumference, upper segment and lower segment ratio, arm span. These are the basic important anthropometric parameters of a child that you have to be perfect with. When it comes to the milestones like gross motor milestones, fine motor milestones, social and adaptive milestones, and language milestones. So, to be frankly, there is no shortcut to remember these milestones. Like milestones in the pediatrics, same topics. Like if you look into the forensic medicine, there are IPC sections, and if you take into the clinical subjects, the important things where you cannot by heart, like investigation of a choice, drug of a choice. So to remember these topics, there is no shortcut. You have to write it down and stick notes on a paper. You better stick it on your reading table or in your room, so that before you sleep or early morning after you wake up, if every day you look at those topics, it will be very easy, because these are the high-yield topics where you can expect questions, and you have to do multiple revisions to remember these topics. So the next topic is, coming to the next topic, it is immunization. Universal immunization program or national immunization schedule. This is a schedule where you have to remember perfectly. Not only in the pediatrics, in the SPM subjects also, they'll cover this topic. So you can at least expect one question from the immunization. So when it comes to the nutrition, so in the pediatrics nutrition part, the most important thing is kwashiorkor, malnutrition, marasmus, or severe acute malnutrition. These are the very important topics. And not only these topics, the other important topics like vitamin A deficiency and toxicity, zinc deficiency, and also diseases, nutritional disorders like rickets and scurvy. So these are the basic and important nutritional topics you have to read. The next topic is inborn errors of metabolism. In the inborn errors of metabolism, carbohydrate metabolism disorders like galactosemia and glycogen storage disorders, organic acidemias, and lysosomal storage disorders are very important. Lysosomal storage disorders are very important inborn errors of metabolism defects. When it comes to the genetic disorders like autosomal dominant, autosomal recessive, and X-linked disorders are high-yield topics. Not only these, single gene disorders like sickle cell anemia and chromosomal disorders like trisomy 21, that means Down syndrome, and trisomy 18, that means Edwards syndrome, trisomy 13, that means Patau syndrome. Patau syndrome. These are the important genetic disorders. So far I have discussed important topics from the neonatology and general pediatrics, but when you are reading, you must go through the entire these important topics, because nowadays they are asking clinical based and concept based questions. To answer those questions, you must you must go through these entire topics, then only you can answer it. You can choose a correct answer. So in my next video, I am going to discuss about the important topics from the systemic pediatrics. Thank you.